Hello everybody. First of all, thanks Dr. Sujata for letting me be part of this instruction course. My topic today is ectasia management. We all know post-LASIK ectasia is a dreaded complication we all face. Whosoever is doing a refractive surgery is constantly under threat of this refractive complication in spite of having good diagnostic and all the precautions. So basically it's optical and refractive instability related to progressive structural corneal deformation after uneventful LASIK. We all know post-LASIK ectasia is abnormal corneal topography, low residual stromal. So although we take all these precautions, still there are chances that we may face this complication in some of the cases. Treatment options available for post-LASIK ectasia, like initially it was RGP lens and keratoplasty. Now few of the options are still available depending upon the refractive or say whatever the refractive outcome. So corneal cross-linking has become an integral part of the treatment. So you get a post-LASIK ectasia, earlier you diagnose, so corneal cross-linking is the mode of management for post-LASIK ectasia case. Then for visual rehabilitation, there are intakes, there are combined procedures, and finally, if nothing happens, keratoplasty is the solution. RGP lenses are useful in eyes, but most of the time, although it's a good solution and it provides stable refraction, but you cannot actually arrest the progress of ectasia in those cases. And patient intolerance is the biggest cause, so patient is never comfortable with this. So role of collagen cross-linking, all we know in last 5, 7, 8 years, collagen cross-linking has become the integral part in the management of keratoconus as well as corneal ectasia. Cross-linking improves the stromal collagen resistance to proteases, which is a proposed cause for ectasia. It actually helps to halt the progression of ectasia and improvement in best corrected visual acuity and keratometric value. It's a constant ongoing procedure. So with basic cross-linking, we have shifted to accelerated cross-linking. Newer and newer nomograms are coming. So when you come across corneal ectasia cases, there are different protocols. Initially, we used to ablate, we used to do PTK followed by cross-linking. Nowadays, what I personally do in my practice is I lift the flap edge, and we use with the introduction of LASIK extra accelerated cross-linking, I simply use the same energy, but the duration is doubled, and we do corneal cross-linking that way. Again, you can say modified cross-linking as shown. Then, say ring segments implant in the segment in the stromal is indicated, where you can actually get the improvement in visual outcome. Ectasia is graded by loss of visual acuity, different grades from grade 1 to grade 4. Now, pre-op LASIK case, which I operate, this is my own case, operated for -7 with -1, pachymetry 500, and post-LASIK 4 years, this is the scenario. Now the post-LASIK refraction is this way. The central pachymetry is 356, and you can see the K1, K2. So in this case, unilateral ectasia, right eye was treated with collagen cross-linking followed by trial RGP lenses, both eyes, and it led to good visual improvement, and patient is with, say, RGP lenses, patient is improving to 6-9 parts. So pre and post CXL, 2 years follow-up almost of this patient, and patient, the refraction is stable. These are the tangential maps for the same. The post CXL 2 years refraction, when he is accepting, this is what the refraction for the patient. Patient has been given again the same thing, say RGP, after 3 months RGP lenses. Second case operated for LASIK in 2011, no pre-operative data available. Patient reported, say, 2 years post-operatively with this refraction and the Pechy of 486 and 473. In these cases, this typical case, the OD was treated with topo-guided treatments and followed by cross-linking in this case, and other eye was done simple cross-linking. So planned CXL. So post-procedure keratometry, astigmatism, and visual acuity actually improved over a period of 3 months. It's remained stable for 9 months follow-up, and patient's residual refraction in this way. So this is the post-operative, post-cross-linking map for this patient. You can actually see the central shifting of the cone which is an actual result of topography guided treatment. And this is the comparison map available. Case number third, 38 years female, high myopic, LASIK done in 2008. Pre-op details are like this. Post-LASIK came with ectasia. How do we treat this patient now? So this is the data 4 years post-LASIK, and now patient has landed it. So plan to intact ring segment for both eyes in these cases. So these were the parameters chosen. Line of incision, we did intact followed by cross-linking in the same sitting with the femto, with the help of femto. Patient's topography, visual acuity, visual quality has significantly improved, and now this case was operated almost 2 years, and this is the residual refraction of that patient and the central pachy and keratometric map. So actually ring segment provides you a good solution for treating ectasia post-operatively, although you cannot predict 100% result or refractive outcome 100%, but yes, you get a good visual quality and a drastic, reduction in the cylindrical and spherical component of it. This is the elevation map pre and post for this patient. Again, a patient with high myop operated 10 years back for LASIK, no pre-op data, both eyes pseudophakic since 6 years, and patient came up with progressive blurring of vision in both eyes. This was the post-LASIK data. Quite a controversial case. Seeing at that case, we actually advised her to go for keratoplasty, but patient was damn against that. So these were the K1 and K2, and under guided prognosis, I attempted doing rings in this patient. Again, the same case, rings followed by cross-linking in the same sitting. So planned insertion of intact 2-ring segment followed by cross-linking. Again was done after 4 weeks because something really went wrong. Wrong in the sense we couldn't do, we were able to implant 1 ring in 1 eye and couldn't insert the 2nd ring as it got opened up, channel got opened. So post-X after cross-linking after 3 months, this was the refraction. And from finger counting, that patient has significantly improved, although not 100%, but this patient post-operatively still is happy. So this is the post-op map for this patient and comparative study. To conclude, although ectasia remains a potential complication, devastating complication after refractive surgery, most patients can regain the functional visual acuity with appropriate management, whether it's a corneal cross-linking, of course corneal cross-linking in 100% of the cases, but depending upon the size of the cone, and you can actually plan, or with the residual thickness, whatever you are having, you can actually plan topographic guided treatment with cross-linking, or you can actually do intracorneal ring segment implant followed by cross-linking, and you really get a good result post-operative. Keratoplasty is, although it's the incidences, but it's rarely an indicated complication, indicated in case of post-LASIK ectasia. Thank you.